Hi, it's me, Brooks. Thank you for joining me on Heal This. Today, we're going to be talking about something that everybody has and the health of it. We're going to be talking about our pelvic floor. And I'm so grateful to have this opportunity to talk to Dr. Laura Gordey and spend some time with her and to talk about pelvic floor health and get some information on it. So, hi, how are you?
Hi, thanks for having me, Brooks.
Thank you. Thank you for being here. I was wondering if you could take just a little bit of time and tell us about yourself and maybe give us a little backstory on how you got to where you're at here right now at this point.
Big question. Yes. Yeah. Wow, big question. So my background education is as a physical therapist. I went
Mhm.
on to focus my practice on pelvic health specifically,
Nice.
even more specifically, women's health. So I just niched, and then I niched again
Yep.
into trauma healing. And so I am
I love
currently
that.
toward the end of my somatic therapy training. And so somatic
Wow.
therapy comes into play a lot with my practice. So that's kind of what I do. How I got here is a very interesting story, but essentially it was a lot of just randomly open doors, and I'm very thankful to be here and doing what I'm doing right now.
Thank you. Awesome. Yes, and all of that is super exciting. I'm excited. Thank you. Um, I know that when you were probably really young, you did not picture yourself specifically doing this, but there's so much importance in it. And so I just feel like stressing that to everyone that, we're all walking around with this pelvic floor. What is it? What does it do for us? Why is it important? And those are the things I'm kind of wondering and wanting to ask you. And I want everyone to know about that. When I was in massage school, we look at every single muscle. And then we got to the pelvic floor, and the teacher literally closed the book and skipped past the slide. And there was quite a few of us in the room that were like, "What's happening? Like, I don't understand." And she's like, "Oh, we don't need to look at that." And I'm like,
Oh no.
"What?" And I'm
Oh
like, I
no.
thought that's a really important part. And she said, "Well, you're not going to massage that." And I'm like, "Okay, but that reaction was really not necessary."
Sure.
So I think that's kind of everybody's first initial reaction is like, "Oh my gosh,
Yeah.
close the book, don't
Yeah.
look at it," or whatever.
Yeah.
Okay, so lots of
Yeah.
questions there. So,
Yeah. That's such an interesting experience that you had with
mhm,
where were you trained, or what city or state were you in?
here, I was here in
Oh,
Nashville.
okay. Okay. So I was about to say, I bet it was in the South. When I used to practice in Louisiana, which is where I started in
Yeah.
Louisiana. If you're listening to this with your kids in the car, maybe don't.
Yeah.
In Louisiana, I would get patients who would be coming in for issues around intimacy, but they couldn't even say the word sex. They couldn't say, "I'm having pain with sex," or "I
Wow.
can't have an orgasm." It was just so um, not acceptable, not PC to say those
Yeah.
things in the South. So I was wondering if your education was also in the South.
Yes. Yeah, for sure. And we actually had individuals in the class that said, but I might go on to want to do some kind of PT later. And you're kind of shying away from even explaining this. And also,
Yeah.
we didn't go past the men's slide very fast, I might add.
Oh, don't get me started, Brooks. That's not why we're here. You're going to get me on a soapbox.
Okay, we won't go there right now. But yes. Okay. Um, so what is the pelvic floor? And why is
Oh,
it
wow.
important?
Yeah.
And yeah, yeah.
Great starting foundation question. So, your pelvic floor is a term we use to describe the muscles at the bottom of your pelvis. So, if you think about your pubic bone in the front, maybe your hips on the side, your
Hmm.
sacrum and tailbone in the back, it's not just bone and skin down there that come to meet up with
Right.
genitals and the bottom of your torso. It's also ligaments, tendons, nerves, and this bowl of muscles that does a lot of things. Primarily, the bowl of muscles supports your pelvis. So if you didn't have that bowl of muscles, you would just fall over. It's almost like the foundation of your core. So most of the time we think about our core is our abs or our
Hmm.
back muscles, but the pelvic, that bottom part is really, really essential. So it holds you up, holds your organs up in
So
your
amazing.
body. It's responsible for bowel and bladder. So it has to relax to let you pee or let you have a
Hmm.
bowel movement. It contracts to keep you from farting, or when you're having an orgasm, those muscles contract. It's obviously hugely responsible in birth. So it plays a lot of roles and a lot of functions. So it's very
Yeah,
important.
it's very important. And it's not just women that have it,
Oh,
right?
no.
Yeah.
Everybody has, well, most people have a pelvic floor.
Yes.
I don't know many people who don't, unless
Yes.
you, I don't know, had a major amputation, but most
Yes.
people have a pelvic floor.
Yes, because I think it's something that only women who maybe have had babies or are a little older, we
Sure.
think about. And that was kind of the other thing. I think I told you this already, but I was in a line at a concert, and the line for the bathroom for the women was just like wrapped around the whole place. And the two women on either
Uh-huh.
side of me were like, we gotta go. Like, we have to go to the bathroom and we have to hurry up or we're gonna pee
You're not
ourselves,
going to make it.
And, then one lady was like, well, when you get older, that's what happens. And the other lady's like, well, after several babies. And I'm like, you guys know that with pelvic floor physical therapy, you could solve a lot of
Way to
these
go,
problems.
Brooks.
Yeah. And they were like, what's that? And I'm like, see, that's the problem, is that we don't know about it. And it doesn't just apply to women who have it doesn't just apply to women, and it doesn't just apply to women who've had babies, and it doesn't just apply to women
Mhm.
who are older, right?
Oh, goodness. Yes, absolutely. There's a whole sub niche of pelvic health that's focused on just children's pelvic health. You've got
Wow.
bedwetting issues, chronic constipation, pelvic pain, and then you get up into teens and early adulthood, and you are also dealing with that, but you might throw in some um, issues around getting ready to have sex for the first time. You might have ejaculation issues, or if you're a man, or trouble with penetration for either gender, and then it keeps going into reproductive age, and then you get into older adulthood, and there's a whole new set of reasons why you might need to address your pelvic floor. So it is cross genders, cross lifespan, all the things.
Love it. Thank you. Wow. I'm pretty sure you're going to blow people's minds, because I know I know some of the circles I run in, and they're kind of like, whoa, what? Just what'd she just say? So, um, what does the what does a typical appointment look like? So maybe you've had a consult with someone, and obviously everybody's different. So kind of something that we could all understand when we come in, and maybe this is a really scary thing, or maybe this is new and we're nervous, and kind of what
Sure.
to expect.
Sure, sure. I can attest to what our practice specifically looks like, and then maybe give you an idea of what you might expect if you went to a different type of practice. So, when you're
Sure.
dealing with pelvic health care, there are three major options. Now, there's a lot of other ones, but you have online programs, virtual health. You have someone like us who is a cash based provider, where we are out of network with traditional insurances. And then you have somebody who is in network with traditional insurance. So maybe think what
Okay.
you might normally think when you think of physical or occupational therapy
Hmm.
in a rehab setting where there's a gym and lots of other people around, maybe out of a hospital. So those are three of your choices that you have when it comes to pelvic health care. Us specifically, what you're coming into, I mean, if you have seen Brooks, we have a room that looks very similar to Brooks. It's one-on-one treatment room. It's very safe, very calming. It's very intimate as opposed to a large gym where you're
Hmm.
working with your therapist and a few other patients at the same time, spending a lot of time with a tech. We really value our practice values an intimate and safe experience. So, and that comes into play a lot because of who we're marketing toward. Now,
Sure.
you might have an amazing pelvic healthcare therapist who's working with different populations that has a different experience. So, but with us, when you come in, we always start with a conversation. And there's no such thing as TMI. So someone might be coming in because they're leaking or they feel like they can't control their bladder. And we end up
Hmm.
talking about how their orgasms look different now, or they've never had one, or they, are pooping every 4 days or something.
Hmm.
So there really is no off limit conversation in here. It's a really safe place for people to talk about things that they don't they don't want to Google, and they feel dumb for asking, and they
That's a
don't
good
know who
point.
else to ask. So it's a great place to do that here. And then typically we will do an external exam. So we're looking at how you move. We're looking from your feet to your neck to your tongue. We're looking at all the things depending on what you're coming in here for, obviously,
Hmm.
and taking a look at what the whole body is saying. And then for those that it's pertinent for, and for those that want it, we will do an internal exam, that internally, usually vaginal exam. If you are in men's health, obviously that would be a rectal exam, and then sometimes rectal exams apply for women as well. But we can address most of the pelvic floor through vaginal exams. And it's very different than if you've had a pap smear
Hmm.
or an internal exam through your OB. It's a very calm. I mean, other than the fact that you're half naked in front of an almost stranger, but it's a very mild, slow experience as opposed to something that feels really invasive, like a pap smear. So that's what typical pelvic health PT or
Hmm.
OT, physical or occupational therapy, looks like.
Right.
And then for me specifically, my sessions can look a little different because we are doing a lot more trauma work because of my training. So that's kind of what your first visit would look like at a typical pelvic health exam.
That's Thank you. I mean, you know, these are our privates we're talking about, and so people get a little
Right,
weird about, like, do we want to talk about it? Or they get very, very private and they think, what's that going to look like? And you're right. So much, um, there's a lot of trauma that gets stored, even if nothing has actually happened to our privates. Emotionally, we tend to store things in this area where we kind of want to hold and
right.
kind of curl down on. So,
Yes.
the thought of somebody coming into our space, even to just touch our pelvic bone, right around that area, feels very invasive. And so, um, that's very helpful to know. And I think we both really work on trying to help our clients, our patients, feel safe and heard and seen, so that they
Yeah.
know that we've got them, that it's a safe space.
Yeah. Yeah,
um,
that's a really special thing that you're able to provide for your clients that not a lot of people do. My hypothetical patients are almost always named Sarah, so we're going to call her Sarah.
I like it.
Well, she's not hypothetical, but HIPAA. I have to protect her identity.
Absolutely, yes.
So I have a patient named Sarah who really wanted to do an internal exam. She was having pain with sex, pain with penetration, and really wanted to do an internal exam. I'm like, great. It's a priority for you. It's a priority for me. So I explained to her what is going to happen in the exam. We got down on the table, got her ready, and we're taught in pelvic healthcare to wait for an enthusiastic consent. We don't ever want to feel like we are forcing someone into an internal exam.
Right.
And so that's the trauma informed piece. But in our practice specifically, we like to differentiate between. So I asked Sarah, I know your brain is saying you want to do this internal exam. How do you know your body is on board for this
That's
internal
great.
exam?
Hmm.
And she's like, what do you mean? How am I supposed to know if my body's on board? I'm saying yes, I want to do it. And I was like, well, let's watch your breathing. Let's look at your tension. What do you
Mhm.
notice in your body as we prepare to do this? And we noticed some anxious feelings. We noticed some tension in her chest and in her stomach. And so we were able to address those and give space for those and get her body on board before we did an internal exam, which is really important. There are some patients where we get on the table and they're not able to regulate their system. And so
Right.
I recommend not doing it, even though that can be really frustrating for people. They're like, I want to do this internal exam. And I'm saying, look, it's really important to me the story that we tell your body in this room. And if we tell your body we're going to ignore what it feels for the sake of the exam or whatever,
Mhm.
that's not going to help. That's not going to help the fact that you have pain with penetration if we just bulldoze your body in what it wants right now. So sometimes it takes a few sessions to just even get the body ready for something like that.
That's really beautiful. What you said was very beautiful. So that you make that connection, that you, the client patient, listens to, all their body, their emotions, because it's true. There's lots of times we're like, I'm just going to do this. And then later we're like,
Right.
I feel sick. That was not
Right.
really what I wanted to do. So,
Right. And there's sometimes it's not avoided. I mean, I'm working with a patient right now who had to get a lot of scar tissue work done after
mhm,
her vaginal birth. And that's
mhm,
something that needed to happen that her body did not want to happen, but it needed to happen. And so we
mhm,
are doing the work at now to kind of heal that let her body experience what it wanted to do. It wanted to run away from the table. It wanted to
mhm,
leave the OB's office and run away, but it wasn't able to do that. And so we're allowing the body to express those feelings and get rid of those impulses now. And so it's able to heal that a little bit. But that's where something like that's where you might transition to seeing me as opposed to another pelvic health provider.
mhm.
Another pelvic health provider is going to be amazing at helping you understand if your body is or is not ready to do something, but they're
Right.
not necessarily going to be equipped with the tools to help you if it's not. And that's when you would transition to seeing someone like me.
Yeah. That's awesome. Um, and also, so after you have kind of those first initial appointments, you said it might be three, or, I'm just saying you might have a few initial appointments, but you're also going to have some homework, right?
Yeah, we're big on homework over here.
That's good. I like homework. Um,
Yeah,
it's good. So
yeah.
some exercises that you would do, and we're not talking just regular Kegels, right? We're talking like, I think
Oh
everyone thinks, oh,
gosh,
I
Brooks,
think,
yes,
I
Kegels.
think, I mean, I think when we started talking about that a while ago, we thought we got this, and we
Yeah,
really don't. And so there's so much more,
right.
there's so many muscles down there, and we just, sometimes we're not using them. And, between, childbirth, which is amazing, it's beautiful, it's a miracle, but it's also traumatizing to the body. And
Really hard.
yeah,
Yes.
so that happens, or I mean, there's so many things that can happen. So, but
Right.
or nothing. And that was something else I wanted to ask you. So even before, you're just a young woman, you're just thinking about maybe having children or whatever. There's things that we can do to prepare for that, right?
Right.
Yeah,
Right.
just
Yeah, absolutely. That's what a great question. I'm a great example of someone who could have used pelvic floor therapy before I had symptoms, maybe. Because I, in my young adulthood life, started leaking a little bit when I ran.
okay.
And I also had a lot of pain with penetration, so sex when I was first sexually active. And so those are things that could have been screened for. Do I think
Hmm.
everybody needs that? No, but it's fine when I don't know how old I was, but you start to know, oh my goodness, I think I leaked a little when I ran. Was that
Hmm.
sweat? No,
Right.
I'm pretty sure I peed. Well, then go get some help. Don't say, oh, well, I haven't had a baby yet, or I bet
Right.
it'll go away, or it'll be fine.
Or
Just go get some help.
that's
Or,
just normal.
right, that's just normal. Or if you want to, I've had lots of people come to see someone who can do an internal exam, whether it's us or an OB or midwife, to see before they're sexually active, to see if they're going to have issues with penetration. I had somebody recently do this because she was going to be leaving the country to get married, and she was going to be sexually active for the first time after she got married, and she knew she was not going to have access to health resources over there. She knew she
Sure.
was already having pain with using a tampon, and so
Hmm.
she said, well, I'm already having pain with tampons, I'm probably going to have pain with sex. And so she came to see us. So that's another great way. We also see women who maybe they don't leak, maybe they don't have pain with sex, but they know they want to get pregnant. And so we will start preparing their body and their emotions for pregnancy, for the journey, and to get their body ready for that. It's so much easier to prepare than it is to repair, especially in pregnancy and postpartum.
Absolutely. Absolutely. I think if
Mhm.
there were specific things I knew before I had taken classes and everything before I got pregnant, you're saying some of the emotional part along with it. And I thought, as my body was changing, if I wouldn't have taken the classes, if I wouldn't have been informed about some of that, I would have thought there's something really wrong with me. And then there's all that
Yeah,
panic that happens, you know? So I love that.
right.
I love education is the key. Like, let's bring it on so that we can feel better about ourselves.
Right.
So,
I'm not a
oh, go ahead.
fan of social media. You won't see us very active on social media, but one of the things I've loved about it is that it has better reinforced the notion that you're not alone. If you leak, you're not alone. If you had a traumatic birth, you're not alone. If you're having issues in your sex life, you're not
Hmm.
alone. And that's been really helpful. It also spreads a lot of misinformation, and but
That's true.
at least people are becoming a little bit more aware that some of these things are very common, and that there's help out there
There's
for
help.
them.
Absolutely. Is there anything specific that maybe we're thinking is normal? We've talked about some of them, like leaking or pain with intercourse or penetration. And is there anything else that you can think of that might be kind of like a low key symptom that somebody might be having? And um, that's pelvic floor. I know I went to the doctor once and I'm like, I'm having this shooting pain down there. And of course, every time I've talked to any other woman about some of this, they're like, yeah, me too. What is that? I don't know. You know, it's a mystery sometimes what's going on down there. And, but when I talked to the doctor, she's like, I think that's pelvic floor. And I was like, oh, okay, cool. That's good for me to know. Thoughts?
Yeah. Yeah, that's a great question. There's a lot of little things like that. From I leak a little bit when I sneeze or jump, whether you've had a baby or not, whether you're a
Mm-hmm.
man or a woman, those are flags that need to be addressed. If you have to strain to poop, that's a flag. If you have issues around orgasms. So, oh, I love this question. I get so many women who think it's a problem that they cannot have an orgasm through penetration alone, and that they require clitoral stimulation for an orgasm,
Yeah,
and they
it's a
think
great
that's an
question.
issue. Like, girl, only it depends on what study you look at, but somewhere in the teens to 20% of people can have an orgasm through penetration alone. It is a very small number. Most women, I mean, that's where our nerve endings are. So that's
Mm-hmm.
something that people think is a problem that really isn't a problem. Or having orgasms is really challenging. That is something that's pretty fixable. Pregnancy opens up a whole nother can of worms. You should
Mm-hmm.
not be leaking in pregnancy. You should be peeing more often, maybe waking
Right.
up at night to pee. Sure, you've got a human squishing your bladder, but you should still very much feel in control. of your bladder, no
Yes.
matter what stage of life that you're in. So birth, postpartum, pregnancy is a whole lot of, oh, well, you're going to have sciatica, you're pregnant, or, oh, you're going to have lightning crotch, you're pregnant, or menopause, perimenopause is a whole nother
Yes.
gamut of, oh, well, you're not going to be able to have orgasms anymore, or you're not going to enjoy sex anymore, or you're going to leak. And certainly there are things that change over time, but these are not things that need to be settled for. If they're important to you, if you want to enjoy your sex life, if you want to know how to have an orgasm through like during penetration, then let's make that a goal. Let's do it. And I
Yep.
want you to love your sex life, love your body, and feel really confident in how you were created to operate.
Yes. I love it. That's awesome. Like,
Yeah.
thank you, because thanks for giving us permission, to
Yeah. Yeah. Oh, I do want to say, Brooke, I didn't answer briefly your question from a somatic perspective.
yeah.
Somatic therapy, for anyone who doesn't know, is about healing trauma through the body. So it's different than maybe cognitive based therapy
Hmm.
or something that's a little bit more cerebral, a little bit more talk therapy or up in your brain. It's a lot more about what the body is saying. And so a
Yes.
symptom that would be an interesting flag is if your body responds to something that you feel like you've already settled. So logically, you've resolved something. Logically, you've forgiven somebody. Logically,
Right.
you've grieved. You've fixed the problem. But yet your body keeps, quote unquote, betraying you over and
Yep.
over. We have a saying that is, if it repeats, it's incomplete. And so if you keep feeling like you just can't physically let go of something, or you keep having a physical response to something that is
Hmm.
bothering you, then that's a flag that or something that you might want to talk to a somatic practitioner about.
Yes. Yes. And I just did that huge training in the trapped emotions in our body, and
Oh wow, we got to talk about that.
yeah, it's changed everything for me. I've seen such a huge difference in my life, throughout my whole body, but even just when things come in, I am not reacting. It's just kind of like sitting there,
Mm,
okay, and then having an
wow.
appropriate response. But so many times I have noticed that their body is telling me something, and they're in almost
Sure.
denial about it. But once
Yeah.
I bring it up, this is what your body's telling me. I can either through muscle testing or through intuitive work, or just, I'm putting my hands on your shoulders that I can feel, and I know that this is living
Mm-hmm.
in your body. As soon as we kind of go there, it starts to flow out more, and they are
Mm,
just recognizing that, yes, there's trauma, there's emotions, there's feelings that come, during a certain whatever situation, experience. It doesn't even have to be considered trauma, right? It's just almost day to day, but there's past stuff there that hasn't been
right.
addressed, so it's triggering it and it's living in the body. So I'm sure, and I'm very curious to hear from you. I don't need to know like deep details or anything, but I would love to know when someone's really working on their pelvic floor, and they're really committed to healing what's going on. Have they made any kind of emotional connection to what's going on there?
Mm. Yeah, that's a great question. I don't necessarily subscribe to the idea that anyone with a pelvic floor dysfunction has a big emotional component there. Sometimes it
Okay.
is from an injury, or
Right.
which that can also lead. Anyway, you know what I'm saying.
Hmm.
But more often than not, there is an emotional component, either chicken or egg. Either the emotional component is causing the dysfunction, or the dysfunction has caused the emotional response. Anyone who's dealt with chronic issues,
Hmm.
even if it didn't come from an emotional place, they got in a car wreck and now they have, neck pain for a long time or whatever. It can be very emotional to deal with chronic pain. So chicken or egg, it doesn't really matter too much. But we see it all the time where people will come in for an example, I saw somebody recently who had a C-section and wanted to do some scar work because
Mhm.
she was noticing she had a little bit of nerve issues down there. The skin wasn't moving very well. So in her brain, she's thinking, I just want a lot of manual therapy. I probably want some core strengthening,
Mhm.
exercise, and hands on stuff. And so we start to work on her scar. And I'm sure you see this, Brooks. I mean, all the time where you're working on an area and it just is triggering for
Mhm.
somebody. And there's this huge either emotional release or they
Mhm.
get very activated and we have to pause and let them go through that wave of
Mhm.
activation. Or there'll be something that, so that's an example of an emotional response to something physical. But then we also have people who already come in knowing that they're very linked. We see that a lot
Mhm.
post birth, and we see it a lot with pain around sex, whether it's from a
Mhm.
past abuse or even if there's no abuse involved at all, it can still be very emotional to navigate sexual dysfunction, especially with pain. So we see that so much, Brooks,
Mhm.
so much in having to balance both of those things. And that's where our practice really shines is balancing the physical and the emotional component of healing at the same time.
Yes. Yeah, because it's, I mean, this is our a lot of our identity, you know, down here,
Right.
and um,
Right.
connecting to ourselves. And there's tends to be a lot of shame around all of it,
Yes.
whether there's pain there or not. You know, it's a lot of the reason why we don't talk about it is because it's shameful kind of a feeling. And
Right.
um, everything is energy, everything is measured by a frequency, and studies are showing that the absolute lowest frequency is shame. And that is
Wow. That's so interesting.
not fear, but this internal feeling of self, as opposed to
Mm,
um, these external things that we're worried about, So just thinking about
right.
that. And um, so,
That's so interesting, Brooks, about the frequency, but that would make sense since
mhm,
shame is I am not enough or I am wrong, as
mhm,
opposed to guilt is I did something wrong. Shame is there's something wrong with me.
yes,
I totally see that being a really low frequency. That is so fascinating.
yes. And it comes even when we're just little children, you know, um,
Oh,
like,
right,
put your clothes on, or what are you doing? Or, kind of like this feeling of like, oh, I don't know, what am I doing? I didn't know I was doing anything wrong. What's wrong with me?
right,
That kind of a thing. And
right.
so, or even
Yeah,
just
if you talk
trying.
to a mental health practitioner or somebody who does parts work
Mhm. Yeah.
around that, most of those parts come out real young, real
Yes.
young.
Yes.
That's and it's not. You're right. It's not just about pain or about sex or about anything that. I mean, I have women who are. It's always about the deeper thing, and I know Brooks. I know you probably see this all the time. Like someone's like, my neck hurts, but it's so much deeper than
Yeah.
that. It's I'll have women who their back hurts. Okay, so their back hurts. They come in, and I'm like, well, why do you want to fix this? I'm like, well, I don't want to hurt anymore. I'm like, okay, but why do you not want to hurt anymore? Well, because I can't play with my kids the way I want to play with my kids, or I can't do the activities I love. Okay, well,
Sure.
why is that important to you? Well, because I feel like if I don't play with my kids, it reminds me of how my mom never played with me because of blah, blah, blah. And I
Mhm.
want to be better than that. And I want to have a different, almost like you're trying to heal your own childhood wounds. And
Absolutely.
anyway, the
We're
back
all
thing is
doing
getting
that
in the
through our
way.
children.
It's so deep. It's so much deeper than my
Yes.
back hurts.
Yes. Yes. And okay, so through intuitive body reading, your back represents support. And like when I say
Mm,
that, it totally makes sense, right? Like it's supporting
Sure.
us all the time. And then segmenting different parts of your
Mm-hmm.
back represent, the low back is financial support or material things, things of the earth, that
Mm-hmm.
kind of support. Up here is our emotional support. So that's why so many people feel so, it's also our truth center where everything comes in. So it lands right there on our shoulders. So much responsibilities. It's always so much deeper, always. So, and you also,
Right.
you made me think of something else. I know too, sometimes I have to reassure people or people close to me, like, you're not gross, like you're a person. Like for some reason
Oh,
we've
wow.
labeled some things as just being gross, and they're just
Mm.
part of life. And so but as little children, we have to watch what we say as adults, like, ew, that's gross, or that's bad, or that's weird, the way that we label them and talk about our bodies. So
Yeah.
anyway.
Yeah. That's so. I just recently read something. Now, I read it on the internet, so it could be wrong, but that as a kid, you don't inherently think that poop smells or like gas farts smell bad. You don't necessarily think that. That's not ingrained in us.
Right.
I think the only, again, Brooks, if somebody knows what I'm talking about, please forgive me that I'm just totally misquoting it. But I think it was like the only thing that is objectively repulsive from a child is like the smell of um, like rotting or like someone who's dead, like
Oh,
rotting
well, that would
flesh.
make
Like that's the
sense.
only thing that
Yeah.
it inherently smells really, really bad. But kids learn based on culture what smells bad and what doesn't. So that's why we see cultures that to us, they smell like really strong body odor and that smells bad to us. But in that culture, that smell is not taught as that smells bad. And so it doesn't smell bad. And so for kids, bowel movements, gas, that sort of thing doesn't inherently smell bad. We just say, oh, that's a stinky poo, let's get you cleaned up. And they are like, oh, I guess it smells bad. It stinks.
Right. Yeah. No, that's exactly along the lines is what I was trying to say, is that we are the ones
Yeah,
putting the label on normal body functions, normal body parts that we walk around being
right.
shameful about. So, yeah, we need to get over that.
Hmm.
So,
Yeah.
um,
Yeah, it's really challenging. And especially because a lot of our because of where we live in Middle Tennessee, especially because our practice is in Franklin, which is a highly conservative area, very religious area, we see a lot of women and men, or we don't treat men, but men are affected by this too. But a lot of women who are coming from purity culture, which if
yes,
you are not familiar with what purity culture is, for anyone listening, it's primarily a Christian thing, but not necessarily. There's a lot of religious organizations that promote a purity culture, which is essentially encouraging abstinence until marriage. Sometimes it goes into dress and
mm-hmm,
things like that, and behaviors that are a little more modest. But it's sometimes done really well, and sometimes it's not done really well. And so we
mm-hmm,
see a lot of people coming into the office who have been affected by either being raised in purity culture or just even being in a culture, like even if they weren't raised in a church, they might have been raised in the South, where that
right,
even if you are not a Christian or not a part of a religious organization, it's just part of the culture. And so they're
yes,
coming in with some of that shame. We see a lot of women who were raised or who abstained from sex until marriage for whatever reason,
sure,
and then all of a sudden sex hurts and they are so
right,
confused because now they want to have sex and they don't understand why their body's like, absolutely not, like not happening. And there's this whole shame component around that. They have a visceral physical response to intimacy because of something that may or may not have been said to them as a child. So interesting.
well, and then once you're in that situation, there's no one to talk to. It's like,
Right.
if you don't have any, who do you talk to about that?
Right. It's really, really challenging. And thankfully, we are seeing more and more religious leaders become better about navigating it from the front end,
Mhm.
when they're talking to their young congregation about this stuff, but they're also doing better and better about navigating it after the fact. When you have couples coming in who need help with their sex lives or premarital counseling, we're seeing a lot better responses from religious leaders, but that's also a huge chunk of our passion. So our practice specifically, now this is not going to be all pelvic health providers, but I am a Christian. So not only was I raised in purity culture, but that's still something, I still am a Christ follower. And so a lot of women, they're afraid to go get help from
Sure.
a mental health practitioner, a sex counselor, a pelvic floor therapist, because they feel like their religious beliefs are not going to be honored
Right.
or they're not going to be understood. That, someone's going to, it's like somebody who is afraid to go get marriage counseling because they don't want someone to tell them to just get divorced because they don't believe
Right.
in divorce,
Yes, absolutely.
and
Yes.
even the pelvic health world in general is getting better about, even if you don't subscribe to a religious belief, we are being trained on what religious beliefs uphold. So, for example, some Jewish cultures, for us to do any sort of internal work, we need to talk to the rabbi and get permission from the rabbi first, because the rabbi is seen as being spiritually responsible for his
Congregation.
congregation
Mhm.
or whatever they call them. So
Sure.
even just being able to honor religions that are not our own is something that the pelvic health world is becoming better and better at doing.
That's amazing. That's fantastic. It has to be an inclusive thing, can't be exclusive. It has to be something that's like, we
Right.
all have bodies, we all have these parts. So, like, wherever you're at, whatever you're believing in, we want to have the best health of it, and so we got to find the practitioners that really
Sure.
speak to us and can support us in the way we need to be supported. So that's awesome.
Right.
And also couples having the conversation, it's like, there's so much that's going on. It's like, how long can you be quiet about how this is not feeling good for me? Because you're doing great over there, but I'm not. And
Right.
I need help. And
Right.
I don't know who I talk to about that. And what's wrong with me? That you're okay and I'm
Right.
not. And that's not the
What's
case.
wrong with me that I don't enjoy sex? What's wrong with me that I
Yes.
don't want to have sex with my partner? What's wrong with me that
Right.
I can't have an orgasm? And it's
Right.
so sad, Brooks. I don't know if you see this gender bias in your work, but we have women who come in here who are having pain with sex, or they're leaking, or there's some sort of
Mhm.
vaginal vulva issue happening.
Right.
And they are so hesitant to spend money to get it better. They feel like they need to
Yes.
really budget. They feel like they need to speak to their spouse about it first. And I never say this, so I don't say this to my patient, but I'm thinking, if your husband was having penile pain, do you think he would hold back? No, he'd be in here every single day.
Yep.
Like, why can't I have an erection? Why
It
does my penis hurt?
it
Like,
would
he
probably
would
be
be in here
free
every
somewhere.
freaking
It,
day.
yeah. It would probably be free somewhere, I'm
Yeah,
just saying.
right. That's true. Let's be real. Let's be real. He's like, you want 10,000? I'll give you $10,000 to fix my penis. But there's something about women where we feel like
Yeah.
we can't pay money to fit to fix our bodies, and I think it goes
Yes.
back to what you were saying about schooling, and there's just more education. Did you know, Brooks, you'll find this fascinating,
No, tell me.
a
Yeah.
year ago they finally mapped the nerve endings of a clitoris, of a
Okay.
human female clitoris. So the penis nerve endings have been mapped for forever. Like, we've known how many there are, we've known where they are,
Wow.
we've known all the things. And then, but they've done it on other female animals, but never on a female human. And so we just now, which we have so many more nerve endings in our clitoris than they do in their penis. It's like unreal.
Mhm.
Which is why we should be having better orgasms than them, and
Yes.
also why we can have multiple orgasms back to back.
Yes.
Anyway,
Right.
praise God for how he made us.
That's right.
But like, it's
I
just,
know.
there's such
It's
a
finally a
gender
redemption to
disparity.
being a woman with all the
Yeah.
other things
Yeah.
we have to, face. It's like, okay, great, but I can do that. I
Anyway, we
think
got on a
I,
gender soapbox, Brooke, that I
no,
was
no, but
not trying to get on.
you're good. And I think I had that moment when I was going back and forth between a UTI and a yeast infection, and then the UTI, and I was like, ah! And it was just
Yeah.
so frustrating because it would always happen on a Friday. I'm like, are you kidding me? Like, how am I going to get this,
Mm.
you know, prescription? And I'm like, and why is it a prescription? Sorry, I don't want to,
Right.
totally freak out on that, but I'm like, I should be able to go and clear my UTI so that especially if you have them often or whatever, or you're susceptible to having them. But that kind of thing, that's where I was like, if this was happening to your penis, it would be no problem. It would be
It's
solved.
so
You
easy.
drive through clinic, be done, so not even getting out of the car. But anyway, so I'd love to turn some time over to your healing journey and just ask you some questions about how has holding space for other women and their healing journey, how has that been healing for you?
Hmm. Wow. What a great, what a great question. I like to joke that if I encounter a patient that I can't empathize with what they're going through, the Lord is really faithful to make me go through it. And is really frustrating. But even when I was doing orthopedic physical therapy, I remember having a man come in who tore his Achilles
Mm.
playing a sport or whatever. So we were rehabbing his ankle. And I was like, man, I wonder what that's like to, I mean, that just, it sounds so hard and painful.
Hmm.
And then I went and strained my Achilles like the next
I
week,
was
and
going to
which is totally
say.
different than tearing it. But I feel like that's been a lot of the journey. Before I was working with a lot of women who were leaking or having pain with sex. That was a part of my journey, and so I had to
Hmm.
figure out how to navigate my own physical healing in that realm before I was able to help other women. And that went all the way up into my own pregnancy and postpartum journeys and birth traumas and postpartum traumas. And so getting to navigate those emotions and the physical ramifications of birth
Hmm.
and somatic training has been very interesting and transformative for me and how I've started practicing with or how I do my practice treating women. So I'm not totally sure if I'm answering your question, but I think that in the training, there's a lot of healing where you're just recognizing patterns within yourself. And then
Hmm.
when you have patients who come, sometimes those things help spark thoughts in you
Yes.
where, yeah, I have patients all the time who are having conversations with their partners and thinking, oh, I've had that conversation with Justin. I wonder if we need to address that. I haven't really thought about that. Or maybe we should tackle that before it becomes a pain point. Or,
Right.
yeah,
Yeah, because
yeah.
that's a really good point. Because when you're holding that space, for me, that is like this, space of love and compassion that I'm welcoming you in to share your
Mm,
soul and most intimate parts of your life, right? And sometimes they'll say things that I'm thinking, I guess I need to think about that too. I hadn't really thought about that.
right.
And then if I talk about it, with my partner or my children, they're like, oh, yeah, I was thinking about that. It's like, oh, you were thinking about that. We need
Yeah.
to have this conversation. And so I think there's a
Right.
huge opportunity to just be more open and more compassionate and have the conversations. So, um, yeah,
Right.
thank you for
Right. And
sharing
even
that.
compassionate toward my own emotional responses in the office,
Yes.
and recognizing when I'm having an activation to something that's happening in the office. So if someone is telling me a really hard story from their past, maybe they were abused or something, and I
Hmm.
start to get angry, I have to navigate, okay, is this a righteous anger where I am angry for them, or is this my own
That's really good.
judgmental, critical, protective self coming out
Right.
and imposing that sort of protection onto them? That's
Hmm.
that's not appropriate, and it tells me that, oh, okay, I need to do some work around that part of me that is getting a little bit triggered by hearing this story, or even, if I have somebody who is not. I had this happen the other day. There was somebody who didn't fit the 90% of how people typically get better. Someone comes
Yep.
in for incontinence.
Right.
There's a 90% path where most people get better along this path. But every
Right.
now and then we get a 5 or 10%er. And she was not getting better. And I was starting to get frustrated. And I noticed that my perfectionism self is coming out, and
Yeah.
I'm starting to feel like a failure. And I'm like, oh, okay, I need to remember it's not my
It's
responsibility
right.
to heal them. It's not my fault if
Right.
they're not getting healed. And it's not my accolade. It is not my thing to be proud of if they do get healed. And so recognizing that, oh, I think I'm getting a little bit too personally
Hmm.
involved, and I need to take a
Yes.
step back.
That the ego steps in a little bit, and you have to go, wait, oh, I'm just the
The
conduit.
ego.
I'm just the conduit here of
Yes.
bringing in light and
Yes.
helping instead of it being about me. So that's
Conduit. Great word.
super deep. I love that. Um, where do you, where would somebody start their healing journey? So, not necessarily physically.
Mhm.
When someone comes in, they know they have some stuff going on and they're doing their exercises, but, obviously, just your thoughts, just your opinion, just your feelings. Where's a really good place to start healing, true deep healing?
Okay. So many resources at our disposal. Somebody asked me this yesterday, a patient of mine. We do a lot of somatic work in here, and she was saying, how long do you feel like I need to be doing this? I was
Mhm.
like, that's a great question. I was like, as long as it's helpful. So if you are having an issue, maybe look at the resources at your disposal. There's so many great resources. There's body work, like seeing someone like Brooks. There's somatic work. There's EMDR, there's
Mhm.
cognitive based therapy, there's marriage and family there's so many
Mhm.
modalities available. Even in the more physical world, like saunas and cold plunges and red light therapy, just
Yeah,
things that
right.
are a little less in the counseling mental health world, and
Sure.
but can still affect our emotions. So maybe just look at it. And what I encourage you to do is to ask your body. So ask yourself, where do I want to start? So instead of getting super overwhelmed at all of the options, just if you are able to drop down and say, where am I most curious about exploring?
Yes.
I'm really curious about what Brooke said about, mapping the body. And I think I really want to try that. Okay, we'll go see Brooks and talk to Brooks about what you're feeling and see what she has to say and what a session looks like, and then ask her what she would recommend, and commit to a few sessions. And if you decide, you know what, I'm not feeling that same curiosity, I'm not feeling that this is the right path, great,
Right.
pick another path. Okay.
Yes.
But I do encourage you that if you do find something that you're resonating with, don't hop, skip, and jump. Like, be committed to the journey,
Right.
and then use that resource until you feel like it's no longer being helpful. And then maybe try something different. It doesn't mean that, like, if you come see me
Mhm.
and do somatic work, and it stops being helpful, it doesn't mean it was never helpful. It just it means it might be time to implement something different or try something else. And that's okay. So
Yes.
I know that's a really vague answer, Brooks, and I'm
No, it was good.
really sorry to not be like, this is where you need to start.
No,
This
no,
is what you
that's
need to do.
I
You need to
that's
alternate somatic and massage and mental
no,
health therapy, and we're gonna like give you this clear plan of care.
no, because it's not
I'm
clear.
so
That's the
sorry
thing.
that I can't do that.
No,
If somebody needs me to tell them what to do, I love telling people what to do. So please just tell me that you want to offload it from your brain and I will come up with a plan for you. I love it. But I would rather you be the instigator of the plan if possible.
that's that's exactly what I was hoping for. I appreciate you saying all of that. It's like I think most people get stuck. They don't know what to do. They have a budget. They don't want to spend a bunch of money in an area that later they're like, that really didn't do a whole lot for me. And so
Sure.
and it's not just one thing. There's not just one, you're not going to go in for one appointment and you're going to just, all your problems are going to be gone. I don't care if you're doing talk therapy. I don't care if you're doing sound bowls. I don't care if you're doing crystals. I don't care if you're, going to,
Mm-hmm.
chiropractor, whatever. You're not going to feel perfect after one appointment. And we are
Yeah.
very complex and there's different things screaming at us sometimes. Sometimes we need to go to the
Mm-hmm.
dentist. Sometimes we need sometimes we just need some self-care. So it's all across the board.
Yeah.
Sometimes we just need
It
to
is. It
rest.
is. I love that you said it's more than just one visit. It makes me think of when my husband, before he was my husband, asked me to go on a date with him, and he's like, he asked me to go on a date, and before I even agreed, he said, "No, no, no, I want 3 dates." I was like, "Whoa, excuse me, I haven't even agreed to one. You're getting a little overexcited here." And he's like,
Right.
"Well, I know you," because we'd known each other for a while. And he goes, "I know you. If we just do one date, you're going to feel this pressure because we know each other so well, because we have this history. You're going to feel this pressure on this one date to know if you want to marry me or not by the end of the date. And so you're not going to even enjoy the date. So I want 3. So that way, the first 2, you can just enjoy yourself. We can
Have
have fun
fun.
together. And then the
Yeah.
third date, you can put all the pressure on it. So maybe if you're trying out a new modality or a new provider, commit to 3. Like, be like, okay, if
Right.
I go in and put all this pressure on this massage that I'm going to get, or this body work from Brooks, I'm not going to really enjoy it and get the most out of it. So let's do 3. And by the end of the third, I will decide
Right.
if I want to continue or not, you know?
It's true. You usually know by the third one if you're like, this is really helping me. So that's a good
Yeah.
point. Well, okay,
Yeah.
so
Justin
I
Gordey's pretty wise. I did end up marrying him. So, it worked.
so we're gonna call it the Justin Gordey theory. Um, do 3 appointments.
Yeah.
Yeah. Oh wow. Well, I wanted to ask some more healing questions.
No, you're good. You're good.
I typically ask my clients if they have a spiritual practice. And I can't remember if we've talked about this before or not, but I most people will respond and say, "Yeah, I go to church on Sunday." And I'm totally cool with that. Like, go to church, that's fine. I just mean more like on a personal level. Do you have something maybe you do every day or more than just once a
Hmm.
week that is connecting you with God, right? Like just bringing you, raising your vibration.
Hmm. Yeah, that's a really interesting question. Um, yeah, so I think I mentioned already that I am a Christian. And so what that looks like for me is a journey of emulating Christ. So if you're not familiar, Jesus from the Bible is Christians believe is the Messiah and provides salvation. And so we as Christians are, if you are choosing to follow Christ, it's as if you are a disciple of Christ, meaning you're
Right.
trying to become more and more like him. So my spiritual journey looks like determining what were Christ's rhythms and how can I implement those rhythms. So that looks
Nice.
like figuring out how to do a Sabbath, taking a day of rest every week. How do we do that in our culture? How do I do that with little children at home?
Mhm.
How do we do that when no one around us is doing that? So
Mhm.
that's part of where we're currently at. It looks like connecting with Father God on a regular basis through prayer, through reading the word. Jesus was a big proponent of reading scripture. He quotes it a lot. So that's a big part of my practice, is
Nice.
reading the story of our people and the story of my God. So that's a big practice as well. Gratitude, like we see Jesus being very humble and gratitude. And so that's a part of our practice, but it looks, and being slow. So one of the things I love that Jesus does really well is he steps away really well. He's
Mm.
not in a hurry. There's a story about Jesus who's going to heal this man's son who is
Mhm.
dying.
Mhm.
His child is dying, or his daughter's dying.
Mhm.
And he's being followed by all these people, obviously, because he's already known at this point. He's done all these miracles. And there's this woman who has this blood disease, and she
Mhm.
stops him, or tries to, touch his robe to get
Mhm.
healing. And he stops and turns, and he's like, who touched me? And
Mhm.
talks to this woman. And his disciples at the time are like, Jesus, what are you doing? We're in a hurry. Like, we got to get to this
Right.
kid who's dying. And then at during this time, somebody comes and tells Jesus that it's okay, the kid's already dead, whatever. And Jesus is not phased. It's like he knows who's in charge. He knows the power that he has access to as the Son
Mhm.
of God. And so he just is very present and very calm. And he's like, we're still going to go. And this girl's still going to be okay. I know you
Yeah.
think she's dead, but what is death to me, and so just trying to adopt that slowness and present, which is very against my flesh and how
Mhm.
I am naturally. I'm
Mhm.
a very driven, nothing is status quo is acceptable kind of person. So that's one of the many ways that we're trying to implement spiritual practice and following Christ in our lives right now.
I love that. That's awesome. Thank you
Mhm.
for sharing that.
Yeah.
And yeah, we're not in charge, you know. So there's lots of
And that's
times.
so hard though.
Yeah. But
Oh, it's so hard.
it's also super comforting, because
Mm-hmm.
um I rely on my spirituality and knowing that I am assisted helping others, and that it's really not me. Like we said before, I'm a conduit
Right.
to bring more
Conduit.
light and love and knowledge and healing to help people. And so
Mm-hmm.
I'm and I'm fulfilled every day. I'm super grateful to have the opportunity to help people. And that's really what started me on this journey of, you know, my own healing and helping others heal. And then as I
Mm,
see the progression for people, I'm sure you feel this way when people go through the series of appointments with you, they're doing their homework, and they're like, it's working and I feel better. And you're like,
yeah.
yay.
Yay.
It makes it worth it, because you've
Yeah.
had all this education and training and you're showing up every day, and it's like I'm doing it. And so to have that happen where people are actually feeling better, it is extremely rewarding to know that um,
It is.
we get to do this every day, whatever it is that's helping people. So
Yeah, such an honor for sure.
yes. And being in people's space is an honor. So um, you know I truly am grateful for that. Is there anything else
Yeah.
that you want to share, or any thoughts that you've had about all the stuff we've talked about that maybe we haven't
Mm.
expressed?
Um, I just appreciate you giving me so much of your time. And for anyone who's still listening, I'm honored to have um, been a part of your space for so long. So I mean, there's a million things I could say, Brooks. I'm
Right.
very
I know.
passionate about what I do,
I know.
but
And I love that.
but we'll just leave it. We'll leave it
Yes.
as is, I think.
All right. Well, thank you so much. I really appreciate you. You're so sweet. You're so kind. And you match that with your knowledge and your ability to help people. And I'm very grateful that you thank you for being on here today. And I will be singing your praises. So thank you.
Yeah. See you around the office, Brooks.
All right. Okay. Bye.